What's up, beautiful people? Another day, another study. We talk a lot about neurodegenerative diseases like Alzheimer's, Parkinson's, and other dementias. We also talk a lot about my APOE4 status. You guys are probably tired of hearing that. But it's made me really obsessed with risk and risk assessment because these diseases take decades to develop. And therefore, identification of risk factors early and early mitigation is paramount to preventing these diseases because by the times that symptoms show up, often it's already advanced into the pathology. And we've seen several drugs recently that failed to make a significant difference, in my opinion, in clinical outcomes. So this study was looking at different patterns of body composition and their association with the risk of neurodegenerative diseases. And they based it on exposure levels, low versus high. Therefore, high exposure to muscle strength was associated with a lower risk of neurodegenerative diseases. A leg dominant fat distribution was associated with lower risk. In comparison, high central obesity was associated with higher risk, and more arm dominant fat distribution were associated with higher risk of neurodegenerative diseases. And then grip strength was associated with lower risk. And we know grip strength is a correlation for overall strength. It's also associated with muscle mass. And what's interesting here is that looking at the central obesity and arm dominant fat patterns, we talk about android versus gynoid, where you distribute your body fat. It seems to be important. Studies are showing that these central obesity and arm dominant fat patterns are associated with more brain atrophy and more markers of cerebral small vessel disease on MRIs. So these associations were similar when they stratified based upon genetic susceptibility. And in a mediation analysis, it looked like a good portion between 11 and 35% of the findings were associated with increase in cerebrovascular disease, which we know are associated with central obesity. So really interesting study. There are some key limitations. I put those down below, but it's further adding to the body of evidence that in order to successfully have a risk mitigation program for several chronic diseases, we need to not only look at your overall body composition, but look on where it's distributed, look at muscle strength. And these are things that I encourage all my patients to check and monitor.